Hello, everybody. My name is Christopher Cabrera, and I want to thank you for attending my presentation on positive reinforcement through ABA. Most teaching professionals use ABA on a fairly consistent basis, whether or not they know they're really doing it. Today, I'll be discussing ABA through the practice of positive reinforcement. So let's start today by defining both. According to Understanding and Implementing Positive Reinforcement as an Intervention Strategy for Children with Disabilities, ABA is a discipline dedicated to the application of behavioral principles to socially important issues, including improving the function of children with disabilities. As you can see, this is a very large, overarching concept and has incredible benefits to our students with disabilities. I specifically chose to focus on one concept, positive reinforcement, specifically for students on the autism spectrum. That is also why I chose to light up my presentation blue. According to autismhelps.org, positive reinforcement is generally the most effective behavior management strategy in dealing with children and challenging behaviors of children with autism or Asperger's syndrome. It can also be used to help autistic children to learn new behaviors from life skills through to alternatives to repetitive behaviors. Positive reinforcement in students can also be so highly effective. It can help increase their confidence and reinforces what a child is doing right rather than focusing on what he or she does wrong. Every student is different, and this type of strategy is a part of universal design as well. There's enough negative reinforcement in this world. Creating a positive space for students to help them learn in will stay with them well after they have left your room. Here are the ABCs of ABA. More specifically, how to recognize what behaviors you want to reinforce. According to autismspeaks.org, the following 3 steps, the ABCs, help us teach and understand behavior. A, an antecedent. This is what occurs right before the target behavior. It can be verbal, such as a command or request. It can also be physical, such as a toy or object, or a light, sound, or something else in the environment. An antecedent may come from the environment, from another person, or be internal, such as a thought or a feeling. B, a resulting behavior. This is the person's response or lack of response to the antecedent. It can be an action, a verbal response, or something else. C, a consequence. This is what comes directly after the behavior. It can include positive reinforcement of the desired behavior or no reaction for incorrect or inappropriate responses. Now, if everyone is different, does everyone need different positive reinforcements? Yep. While positive reinforcement is effective, it can only be truly effective when the teacher knows their student. Here are 5 types of reinforcements that can help your students. 1. Direct reinforcement. Student did something well, and it was immediately recognized, so the student attempts it again. 2. Social reinforcement. The student did something well, and it was recognized by a note home to a parent or guardian. 3. Activity reinforcement. The student did well, and now they are able to do a preferred activity they were not able to do before. 4. Tangible reinforcement. Food, stickers, balloons, or awards. 5. Token reinforcement. The student collects points to be turned in on a later date for some type of personalized reward. So as you can see, there are many types and many things you can use to entice a student to do an appropriate behavior. Wait, so are we just bribing these students? No. Bribery happens before a behavior and reinforcement happens after a behavior. That difference is allowing the students to make the choice on their own. Positive reinforcement is shown to reinforce a behavior and a reward is given. It is understood that with autism, there is no one-size-fits-all plan. The autism spectrum is truly vast, and so what may work for some may not be as effective with others. Here's an example to show how easily positive reinforcement can be implemented in a classroom. Antecedent. The teacher says, "It's time to clean up your toys before lunch." Behavior. The student cleans up their toys. Consequence. The teacher rewards a student with a token to be used later for their own personal reward. Now, the student is happy to receive the token reinforcement and has the choice of reward later. Ultimately, we want the student to be able to better control their behavior, and through the implementation of ABA's positive reinforcement, the student will have more reasons to perform positively. So, an example of ABA through positive reinforcement from Hastings' one-year outcomes from school-based ABA for children with autism showcases a small sampling of students in the United Kingdom with autism being tested with standardized testing that measured cognitive and adaptive functioning. This test took place in the first few weeks of school and then again 12 months later to follow up. During the school year, prior to the follow-up, the 11 students were educated in an ABA intervention-based class. The result of the following test shows positive IQ changes across the board for all 11 students. Now, while there may be other variables at play over the year, of course, the use of ABA is certainly a large factor. The success of the class provided administration confidence to accept ABA strategies in a mainstream general education setting. Now, that's only one of many studies to speak about, but simply try it in your classroom and you will be amazed to see how it can be effective for your students. Again, I want to thank you once again for attending this presentation and hope you've enjoyed it. Thanks and have a great day.